I agree with you. We all want to strive for safe and compassionate care for all our constituents and people in Wales. And I therefore welcome the statement that you've given today, particularly on the attempts to ensure that we get that during the winter pressure months. And praising the professionalism and dedication of our staff, and I declare an interest, and my wife is one of those members of the frontline staff. But it is important that they actually are recognised for the hard work they put in. And I join Angela Burns in a couple of points. I am concerned about the workforce levels, particularly sometimes when we see sickness levels be increased as a consequence of the pressure that puts on the remaining staff. And I would like to ensure, perhaps a consideration of how that will be tackled, and particularly also in relation to district nurses, because district nurses, as you identified, they're more in community, but there is a shortage of district nurses across the areas, and as a consequence, I've experienced it directly. There are sometimes difficulties in getting district nurses to come out to support individuals because of the pressures upon them. On your statement, a couple of points. You've talked about the extra beds. I am asked the same question. The staffing levels and the resource levels for those extra beds. Because what I don't want, I'm often told by the health boards, more beds and we'll fill them quickly. I don't want to see more beds and filled up and then just being stagnant, because delays of care and transfer, sometimes in my patch, are not as good perhaps as they are across Wales. And it's important how we put the staffing levels in to ensure that those are used effectively. You talk about an improved use of social workers, not more social workers. Are we going to be looking at more social workers based in hospitals so we can get those care packages rather than an improved use of social workers? You mentioned additional step-up, step-down services in your statement, and that the beds are also used as a step-up for people in the community to avoid hospital admission. But who's going to actually admit them into those units? Who's going to make the decision as to whether they go into those units? Will that be a GP? Will that be a nurse? Will it be the individual? Who is actually going to be deciding whether they go into those particular units and those particular beds? I also want to perhaps ask questions about the elective surgery we often see postponed or cancelled. Last year, in my own health board area, they cancelled several elective surgery cases for a couple of months. As a consequence, we saw patients having to do further delays and experiencing further pain and anguish whilst they waited for the next surgery coming through. What sort of indication has been given by the health boards that they are taking those matters into consideration and that patients will not be experiencing the lengthy delays? We often see them going up to the 36 weeks and sometimes beyond the 36-week target. But I don't want to see these patients going beyond simply because they haven't considered how they will tackle elective surgery during that winter period.
Thank you for the points. A number of similar points to Angela Burns and some novel ones as well. In terms of the workforce challenge, I say we recognise that in every statement that I make in this chamber, every set of questions, I expect to get asked about workforce challenges. Challenges that are not unique to Wales, but we have responsibility of helping to navigate our way through. I recognise the challenge about district nurses, even though other forms of community nurses have increased in number. And the challenge always is, how do we provide the right service so it's available for citizens and they can get good quality care and advice and support? And actually, nurses are really important, keeping people out of hospital as well as caring for them where they are. We're making better and better use of the skills of the nursing profession, both to triage and to support people and to keep them in their own homes for longer with more independence. And actually, nursing staff are crucial, of course, to making extra beds work within an acute setting. And there's always a challenge about how and what you flex. Some of the staff within the system are prepared to work longer hours, but for a period of time. You can't expect that level of activity to go on through the whole year, in addition to the potential to have proper contract agency arrangements as well. Now, the challenge always is about understanding the financial demand that brings as well. But there is a need. If you need extra bed, extra surge capacity about how you staff, that has to be part of the planning process. And that's what we expect that every health board, with their local authority and other emergency service partners, to understand what they're doing in the whole plan. And I'm happy to confirm with social workers, we're seeing more social workers placed in hospitals as well as part of the team. It isn't simply about organising and taking people in different parts of the system. We know there's a challenge with the social workforce about our numbers, but actually there's a recognition that it's a better place to have more social workers there as part of that team to help support people to return to the community. And in terms of admission to any facility or another, it will have to be the clinician or the team of clinicians that will make that choice. It won't be driven by points of view about finance. It'll be driven about what is clinically the appropriate place for someone to receive and take part in care. And finally, I want to deal with perhaps the main new point you make about elective admissions and elective activity. We know that in the winter we actually see a significant amount of elective activity take place. It isn't true to say that no elective activity takes place in the winter. There are compromises made between unscheduled care. There's an increase in bed capacity taken up through unscheduled care, but elective activity still takes place. And in fact, in last winter, comparing January and March in 2016 to January to March in 2015, we saw more than 4,000 additional elective procedures take place within NHS Wales. So there's a real need to continue to see more activity take place to make sure people don't wait unacceptable lengths of time. I don't want to stray into an entirely different point, but I recognise the challenge and the pressure on elective activity in the winter, and some of the £15 million of resource we've announced will go into supporting elective activity through the winter.
And finally, Dawn Bowden.